Hi, my name is Sam Haney, and I'm going to be talking about the article Affirmatively Furthering Fair Housing, a Platform for Public Health Advocates. And it's by Brian D. Smedley and Philip Tegeler, and it was published in the American Journal of Public Health in 2016. And I also watched a video with Gustavo Velasquez as the featured speaker, and he is the Assistant Secretary of HUD. And so this is obviously about the Affirmative Furthering Fair Housing program, which is kind of taking the Fair Housing Act and furthering it, going on how they can implement it and decrease inequality through housing and new opportunities. And why I chose this article, well, for many reasons. One thing that really surprised me is how powerful where you live is, because in this article it talks about how where you live can affect your income, your opportunities, your child's education, your health, like air quality. In the video, it talked about how just one part where a girl had asthma lived, how it affected her health, and the program helped her family move, which created better opportunities for her. She felt better, and also it also improved her mother and her brother's life, because the mother then went on to community college and things like that. But it also talks about the effect it has on children's life expectancy where one lives. There was an 18-year difference between two neighborhoods that were within 10 miles. So that was one thing that kind of interested me, is that because I always thought, it would be from one city to another, but it's from neighborhood to neighborhood. It can have a huge impact on your life. And yeah, I wanted to know more about the modern policies within the Department of Housing and Urban Development. And it talks about inequality and how this new program will help communities and how it helps them, and how it relates to the chapter. Well, it talks about the new program that was created by HUD. It relates to Chapter 18, or Unit 18, I should say, and how how old practices such as redlining and steering affect communities even today, because although the Civil Rights Act and the Fair Housing Act did pass, the policies that affected many people and discriminated against many groups and set them in different neighborhoods still affects those same minorities today, and impoverished groups. And to summarize a little more about the article, it talks about how it gives the main point of the new part of this program is to give access and opportunity to housing and to decrease wealth inequality through housing. And as I said earlier, because that can also be connected with things like food quality, crime, air quality, school, and education, because even things like food, there's certain areas that they don't have the same stores, and it's hard to get access to healthy food, was one thing that they saw in some of the studies. And also set attainable, realistic goals to eliminate obstacles to housing choices, give local municipalities information, guidance, support, and tools to give access and give opportunities to low-income families. So, for example, one thing that these municipalities or local counties or cities could do is develop affordable housing in areas that promote integration in areas of high opportunity. Choose to provide and preserve affordable housing and remove barriers to the development of affordable housing in areas of low poverty. And yes, so the whole goal is to expand opportunities and create equality. And I think that, yeah, the students should definitely be aware of this, because even though we have had the Civil Rights Act of 1968, the Fair Housing Act, passed, we can still see that many of the policies earlier still continue today, and we should be aware of them. And they actually talked about that, how people not being aware of these problems can us lead to not seeing them, and people not getting the proper support and care that they need, or the opportunities. And for that reason, we can see inequality increasing. So yeah, so that's why I think it's something that students should be aware of.